Good morning. My name is Julio Panza. I'm the Chief of Cardiology at Westchester Medical Center in Valhalla. And today we want to talk about cardiac disease or diseases of the heart. I think it is important to understand a little bit about how the heart works, what the heart is as an organ, in order to then understand better what are the conditions that affect the heart and what can we do to prevent them, ideally, or to treat them if they present themselves. The heart is a complex organ. Its main function is to pump blood to the body. To do that, the heart has a muscle. The heart is muscle. But that muscle needs help. It needs help from valves that will direct the blood flow in one way and not another within the heart. And very importantly, it needs supply of blood to the heart muscle from specific blood vessels that we call the coronary arteries. So the coronary arteries are the blood vessels that bring blood flow to the heart muscle. Why is this important? Because the coronary arteries are the source of the most common cause of cardiac disease, and that is coronary artery disease. And what is coronary artery disease? Is the deposition of plaques of cholesterol within the wall of the coronary arteries. It's just like with any pipe that brings water to a field. If there is an encroaching of the wall into the pipe's lumen, there will be less water going to that field. Similarly, if the cholesterol deposition encroaches on the lumen of the coronary arteries, then there will be less blood flow going into the muscle of the heart. The deposition of cholesterol takes years, usually decades, to get to a point where the lumen of the vessel is so narrow that the blood flow is impeded. Unfortunately, what can happen is that without necessarily the lumen of the vessel being so narrow, the plaque can rupture. And when the plaque ruptures, the phenomenon that follows is similar to what happens when we cut our fingers and we have a blood clot. The problem is that when the plaque ruptures inside the vessel, that blood clot will completely occlude that vessel and will not let any blood go through, and therefore the muscle is left without the supply of blood flow. Settle. That is what we call a heart attack, or in medical terms, a myocardial infarction. The most common cause of death as a consequence of a heart attack is sudden death. And at the same time, the most common cause of sudden death overall is a heart attack. So it is therefore important to try to prevent the development of coronary artery disease, as opposed to wait until the disease presents and treat it at that point. We can certainly treat it, and we will talk about that in a moment, but it's much more important and more effective to try to prevent. And prevention starts at an early age and revolves around four major risk factors. Number one, smoking. Number two, high blood pressure or hypertension. Number three, high cholesterol or hypercholesterolemia. And number four, diabetes. There are other important risk factors such as family history, particularly when it's family history at an early age in the family, and obesity. When we're talking about an individual person, not everybody presents with the same profile of risk factors. So that particular individual must focus on what is important for him or for her. For example, if a person is a smoker, the most important thing for that person is to stop smoking. If that person is not a smoker, good for him or for her, that's nothing to worry about, but that person may have high blood pressure and then should focus on that, or may have diabetes and should focus on the control of diabetes. Once the disease presents itself, the cardinal symptom is what we call angina pectoris, or chest pain. Now, not all chest pain comes from the heart. As a matter of fact, There are a lot of causes of pain in the chest that have nothing to do with the heart. But pain that feels like an oppression, pain that radiates to the shoulder, particularly the left shoulder, even the upper extremity, particularly the left upper extremity, that radiates to the jaw, is pain that should be considered as coming from the heart until proven otherwise. Particularly the pain presents when one is doing some physical activity, such as climbing stairs or walking fast. If the pain presents at rest, and if it lasts more than a few minutes, and if it has the characteristics that I mentioned before of feeling like a pressure radiating to those parts of the body, then there is or should be a significant concern for the presentation of a heart attack. Going back to what I mentioned before, a heart attack occurs as a consequence of the sudden occlusion of a coronary artery. So the treatment for a heart attack is the immediate opening of the blood vessel. If one is at home and starts having pain that lasts for more than a few minutes, the most important and the only thing to remember to do is to call 911. It is a mistake to try to get in a car and either drive or be driven to an emergency department. That has led in many cases to the unfortunate situation of a sudden death occurring during the transportation and having a bad outcome as a consequence of not calling 911. So the focus should be, when there is the presentation of chest pain, to bring the point of care to the patient and not to bring the patient to the point of care. What is the most effective and the best way to open an artery is to do it in the cardiac catheterization laboratory. What is that? That is a place within a hospital where there's equipment and there are physicians and there are non-physician medical personnel capable of placing a catheter, which is a little tube inside the heart, and opening that vessel that has closed, and that provides immediate relief with immediate restoration of blood flow. Not all hospitals are capable of doing that, or they're not all equipped with a 24/7 cardiac catheterization laboratory, but you as a citizen, you don't need to know who those hospitals are or where they are, but rather what you need to know is to call 911 and the emergency medical services will take care of that. It is important to know that the American Heart Association has heavily focused on patient education. The American Heart Association website has plenty of materials regarding prevention and treatment of cardiovascular disease, written at a level that is easy to understand. So I would strongly encourage everyone to visit the website of the American Heart Association as the best resource for prevention and treatment of cardiovascular disease.